Rumors abounded that he was this reclusive because of a drug abuse, a syphilitic condition, or a terminal dementia. Actually, all his strange behaviors are readily understandable as symptoms of a severe case of OCD. Sadly, there was no treatment for OCD in Howard Hughes' lifetime. It would be another decade before the disease would be identified as a brain-related disorder. I frequently cite the case of Howard Hughes to help my patients understand that this disease, OCD, is an insatiable monster. The more you give in, the hungrier it gets. Even Hughes, with all his millions and a retinue of servants to platform the bizarre rituals his OCD told him to perform, could not buy his way out. Eventually, the false messages coming from his brain overwhelmed him. If you are one of many who suffer from OCD, whether it is a mild case or one as severe as Howard Hughes, this book will show you how to fight and beat it. OCD is a tenacious enemy, but a strong-willed, motivated person can overcome it. Along the way, you will also learn a good deal about your brain and how you can control it better. You will read stories of courageous people who, by applying the 4-step method, learned how to overcome the dreaded feelings of brain lock that are caused by OCD. This method, which has been scientifically demonstrated to enable people to change their own brain functions, will be described in such a way that you can readily apply it yourself. So this book is very much relatable, and it will go into like stories of different types of OCDs that are out there and the levels and severity, and it will basically go through all the different types of OCD and the stories of people who learned how to overcome it and their progress from before and after for like the severity of OCD is shown. For me personally, it's transitioning that I have a lot of OCD in, transitioning from one task to another task or transitioning from one place to another place. I do a lot of repetitive tasks and a lot of checking to make sure it's just right, like an OCD patient would describe. And when it feels just right, it has to be done in either sets of 3, 9, or 81, because 3 squared is 9, 9 squared is 81. So I do multiple things and check multiple things about 3, 9 to 81 times, and usually I'm counting in sets of 3s and starting over in every set of 3s. So hopefully we can dive deeper into the book and learn on how to combat OCD.